is Dr. Masud from Northridge Chiropractic, and we would like to show you in a minute in this coming video of two identical patients. Almost they have identical problem. Both they have occiput on base of their neck and neck problem. Both they have their ribs out, and both they have their pelvis needs alignment. I want to show you two different ways of treating a patient. One is regular osseous adjustment, one is instrument adjustment with non-force. And in our office we perform both, and some patient rather one technique, another patient rather another. We offer both, and I would like to you see in this video what's the difference, because a picture or video is a lot more value, and you understand much better. So let's go and we see the patient how they do. And we want to show you how we do non-force adjustment, non-force technique with instrumentation, instrument adjustment, and also we want to show you how to level the pelvis with low force technique. Of course, very first we're gonna palpate the patient. Of course, she needs lots of different places that need stimulation and alignment. And the way we see, you see how, Marijan, can you come here and show? You see how this thing is not level on her pelvis? You see how my finger is higher than this finger? So since these are not level, if I go cross, this is almost 1.5 inches difference. This should be on top of the ilium. So when we go here, it's not really level. So our goal is these two fingers, they should be at the same level. So what we do, we put one block under her greater trochanter or hip bone, another block the top of iliac crest, this is another pelvic bone, and go ahead and see. Look how my finger now they touching. And even though this is slightly still, but we leave the patient. So while the patient, her pelvis getting level, what we do little massager, so to relax her. Also relax her gluteal muscle by moving the hip bones. Should high some. Once we make sure she's relaxed and this is level, we take this off, see if she's holding the, and yes, look at it. This is after taking the blocks off. She's still level. Lift up your belly a little bit. So next thing we're gonna check her occiput, the base of her head, to see if that's level. And if you can see, her occiput is not level. On the left side, this thumb is lower. Let's say thumb number 1 with number 2. Number 2 is lower if you pay attention. So what we do, slowly, few bursts of energy. I assure you she's no pain. Now you see how level she is. Still a little bit more. see level. Then next we're gonna go, I cannot show it to you in video because that's about feeling and palpating her neck, and she's, I'm sure she's feeling this is out. We change the setting. Show you that she has some occipital problem. We're going to adjust the occiput and we're going to see how the range of motion is after the adjustment. She has some rib problem. We're going to try to take care of rib problem as much as we're going to do adjustment. This is osseous chiropractic adjustment we're going to perform.
Off breakfast?
No.
I feel good.
Okay, now I'm going to show you how to adjust her rib. Now go ahead and put this down. We're going to grab this here. You put her hand on here. We're going to find the segment that she's out. Bring her down. Thank you. Now this is osseous adjustment for the pelvic. Of course she has it high on this side. We find the top of the thing. And she on her low back. That's it.
Yes, my neck was really tight. I couldn't lift my head up. It's very tight. My left shoulder, I believe some ribs are out. I have some numbness through my arm, and then my hip also was clicking.